burns. We already went through that, and just remember it in the back of your mind as a principle. The best way to prevent infection is intact skin, right? So burns, oh my God, like if they even in your fucking hospital, they got a lot of their body that's not intact, okay? It's like no skin at all. The same is true for post-op. You cut me. My skin is no longer intact. So therefore, I'm at risk for an infection. Now, it ain't like I got a white blood count that's low and I got pancytopenia and my spleen is gone. Nah, ain't none of that. So they last on the list. They ain't that bad. But you've got to remember in your mind, they are at risk for an infection. Okay, just because you cut them, that's all. Okay, all right, y'all, so you good. Now, so when we look at infectious disease, go back to your packets. And you look at this page, because I got to show you something else you got to know. You look at this page right here. This page is in here because I wanted you to see how you can take a disease that's mostly droplet and make it airborne. Because technically COVID is more droplet until you do some shit to it. So look at this part right here, the middle part. And I want you to look at the word goggles required for what? Aerosol. I want you to say to yourself on this test, aerosol is airborne. So these aerosols that we use, these procedures that makes the condition airborne, very often because of what you're doing to the patient will make something that's droplet, now it's airborne. So let me give you examples. So it says sputum induction. So what the hell does that mean? Well, if you notice, if you remember how to collect a sputum culture, which is a pain in your ass, and if I'm really honest with you, because I'm ghetto, should I tell them this? Yes, I should, because I like to be transparent and honest. When a patient has a sputum culture, I'd be like, oh, the next shift can get that. I'm sorry, y'all. Y'all pray for y'all girl. It's just so trifling, but that's what I do. Okay, but I do that because it's so horrible to collect a sputum culture. You got to get the patient to cough like and spit all this shit in a cup. Now I'm nauseous looking at your punk ass doing all that. Okay. But when they hacking and coughing, trying to get all this crap in the cup, you just made the condition pretty much airborne. Now, bronchoscopy is a procedure. You guys know that. That's going all the way down your throat and your esophagus and your trachea, whatever. So that's your bronchoscopy. So, put a highlight on this one. Trach suctioning, or you see where it says airway suctioning and trach care. Both of them is where you're going to be at in your life. So when you're doing trach care or you're doing suctioning with your trachs, you just took COVID and made it airborne. So that's why all them patients in the ICU was making their nurses die. Okay? All right, then you see intubation. You know how many times we got to intubate people in the ICU. So this is where ICU nurses was catching hell. Here's another one, and I don't know if you know what this is, but put asthma or breathing treatment on the end of it. Aerosolized or nebulized medication administration, that ain't nothing but a breathing treatment. And you know who get them? COPD and asthma. Those are just breathing treatments. COPD and asthma. Yep. So think of it like this, y'all. If you give them that nebulizer to be breathing in or whatever, like when respiratory comes around and give their breathing treatments out, we lost a lot of respiratory therapists because they died because they used to be in the room with that bullshit and they didn't know no better. When we figured it out, we was like, oh my God, give the patient the treatment and get the fuck out and close the door. And then put a sign on the door that do not enter, treatment in progress. How many people kind of saw that when the respiratory would come around? Anybody saw that when they came out? Yeah. So it taught us a lot because we lost nurses and respiratory therapists. And a lot of it was we caused ourselves to get the infection when you threw it in the air like that. Okay, here's another one for y'all, and this is probably the one on the test. You see it says positive pressure ventilation. I need you to know BiPAP and CPAP have been on that test. So when you're giving a patient BiPAP or CPAP, you just made their condition airborne. So goggles need to be on for all of this. And then high frequency oscillatory ventilation, that's just your patient on a ventilator. In other words, when you look at some of the things that we do with our patients, look what I got up here. There's a little G for some of these things. These little tiny G's, when you actually take your picture, this is a G, mean goggles. Goggles may be necessary. Goggles are definitely necessary for those types of actual tasks that nurses do. Okay, then I want you to turn the page till you get to this. Y'all got it? Okay, now, this is putting on your PPE, right? So you know me, I'm silly as fuck, and there's a video out there somewhere of me acting just a natural born ass, dancing and doing whatever. But what I do is I tell you, when you go on the test to do this, and a lot of times it's like a drag and drop, and you have to put it in order, you just gonna go and think about feeling yourself. Okay, so we're gonna start down here, y'all. Y'all ready? Y'all ready for me to film? Okay, y'all ready? Okay, so if I'm going into surgery, what's way down there? Yeah, put your booties on first, right? If you're going into surgery. So put at the top, if you're going into surgery, put your booties on first. That's called booties. They call it shoe covers, booties, whatever. So put that at the very top above the gown. Because that's not typical, but I want you to know in case you failed a bunch of times, it's a bullshit. They're going to be on your test. If you're just going to surgery. Because we don't wear shoe covers every day. We only wear them when we're going into surgery. So far, so good? Okay, watch this. So, I'm feeling myself. 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 What did I just put on? A gown. You see, that's first. Okay, all right, y'all ready? I'm feeling myself. I'm feeling myself. I'm feeling myself. I'm feeling myself. What I just put on? A mask. A mask. See? Your punk ass gonna be on that test like. Okay. You seen it? Man, I was getting down on that side. Okay, y'all good? Y'all got your mask on? Okay, here we go. I'm feeling myself. I'm feeling myself. I'm feeling. What I just put on? Goggles. Your punk ass better pay attention. I ain't just fucking dancing for nothing. Y'all ass better look at what the fuck I'm doing. I felt my eyeballs. Fucking goggles. Okay, then you just, finish it off all up in here. Now, what's this when I do this? Gloves. That's going to be kind of hard, but I got a concept for you to remember. The part that's going to touch the patient must be the cleanest. After you touch the patient, it's the dirtiest. So when I turn this page, it's going to be just the opposite. Okay? All right. Turn the page. Now, this page is taking it off, right? And you can have 2 pages that talk about taking it off. The one I want you to look at is it says how to safely remove PPE. Example 1. Example 1 is the one on the test. Y'all see that up there? Say example 1. Okay. Now, what I tell you for this one is right here. PPE order of removal is alphabetical. Now, we got to go back to 2nd grade. And I don't know, some of y'all might have failed 2nd grade. So we're going to pray about it. But if we go back to 2nd grade, G came before the M, but then peep this, all three of these start with a G. So it's GL before GO, but then these two start GO. So it's GOG before GOW. So the principle though, because you know, some of this is memorization, but other parts is just you gotta know the shit. The principle is when you're done with the patient, the dirtiest part of you is your gloves. Get them off quick, right? That's the principle, okay? So get the gloves off, get the goggles off, then the gown, and then I kind of try to rhyme it a little bit. Mask is last. And it's just not as simple as saying the mask is last, because if you have a surgical mask on, let's say that you have the kind that ties, because some people didn't like the ear thing. Let's say the kind that you had, the surgical mask you had on, ties here and ties there. Bottoms up. Remove the bottom string before the top. If you have the kind that's on your ears, you put your fingers underneath and you lift and remove it. If you have this N95 mask, you'll see the two rubber bands in the back, right? You see the two rubber bands in the back. One is up here, one is down here. You have to take the bottom one off and peel it off. You have got to do bottoms up. What was it, 50 Cent or was it Ludacris? Who said it? Who said that shit? Bottoms up, ass up, head down. I don't know. Them days was fun. Okay, now, let's see what else Shonora else is doing here. Okay, children, let's go to sepsis. Sepsis is a part of every little pumpkin